that I think it's what I think is going on. So, Doug Pagitt on this healthcare situation. First of all, we need to really reconsider not just how we get more health insurance coverage to people, but the entire project of how we decide to pay for health care in this country. So let me take you on my own little primer on what I think the problem is, because the problem is too big. Here's basically setting this up. Whenever you have an issue in which reasonable people, otherwise agreeable, informed, wise, decent people can't agree, the problem is almost always that someone has framed the question in a way that it can't be answered. So now sometimes you just have people being a pain in the neck, sometimes you have people that are just being obstinate, sometimes you have people that are just being selfish, but on this healthcare question, what you're going to have this week, I guarantee it, over Thanksgiving, people are going to sit down at their Thanksgiving table, and folks who otherwise agree, otherwise can be civil with one another, are going to be out of their minds on this thing. And I think it's because we have a situation in which the questions have been framed in the wrong way. So here's what I think the problem is. The problem is that we have decided in this country, sort of by accident, that the way that we're going to pay for our health our health costs in this country is through insurance. Now here's what I mean. We've decided that we want to use something looking like and sounding like an insurance program as the means by which we're going to pay for the coverage that we get. The problem with that is that health care insurance functions virtually like a Ponzi scheme. Now, if you don't know what a Ponzi scheme is, you've heard it a lot. Madoff was in a Ponzi scheme. We've got our own little local Tom Petters here who's involved in a Ponzi scheme. A Ponzi scheme was innovated in the early 20th century by a guy with the last name Ponzi. That's where they came from. Yes, his name was Ponzi, and a lot of these innovations that have these funny little names are someone's last name, like Fahrenheit, the way that we keep track of our temperature. A guy named Fahrenheit who didn't like the Celsius form. So anyway, this guy named Ponzi came up with this plan where basically he was going to take money from one group of people, promised to give it to another group of people, and promised more money to the second group than he was taking in from the first. And the way that this worked was, he said, as long as everyone doesn't call their debts in at the same time, this thing's going to work fine. So that's what you saw in the Madoff deal. That's what you see in a lot of banking. Like if there's a run on the banks, it's because they're in enough money, right? And the reason you're given penalties for early withdrawal of your money from a bank if you've got in a CD or something is because they don't want everyone to go take their money out, right? If everyone went and called in all the money that's owed to them, there wouldn't be enough. It's the way that it works. It's being invested, and some people are losing and some people are winning. Well, here's what's happening in the healthcare industry. People now treat healthcare payments. They're treating healthcare payments like they're in a buyer's club. Meaning they want to pay a certain amount a month for insurance. It might be $100, might be $500, might be $1,000 a month. And they believe then that paying that amount should cover their health care costs. So people's belief is that if you buy into an insurance program, that you can receive more benefit than the amount of money that you pay. Here's the problem. If everyone does that, if everyone thinks I'm going to pay $500 a month for insurance coverage, but I'm going to receive $600 a month in benefits, it doesn't work. And so what insurance companies have tried to do is they've tried to say, well, let's have this fellow over here pay $500 a month for his health insurance coverage, but he's only going to use $300 a month. And this gal over here, she's going to pay for her insurance, and she's going to pay $500 a month, but she's only going to use $400 a month. So now we're up $300 a month. So that guy over there that needs to use $600 a month, that's fine because we can cover it out of the excess that comes from these other people's premiums. What has happened is people believe that they should receive a greater amount of benefit than what they pay in. So the problem certainly is that insurance companies are run poorly. I've got a whole rant that if I have time here this morning, I would love to go on about how insurance companies and their negotiations with the health service providers are basically functioning in collusion, right? They're basically price fixing these people. And and all the over expenditures and all that. I mean, I'm all for it. Look, there's a massive amount of waste, but if you take all the waste out of the system, ultimately the problem still lies in the fact that we've decided to pay for our health care costs through an insurance-based buyer's club. And when you do that, when you've decided that the way you're going to pay for this is by joining this club where you're going to receive more benefit than you put in, and everyone does that, there's not enough money. The only way an insurance program can work is if some people pay for premiums and never receive the benefit of that insurance policy. The only other way it can work is if the insurance companies invest the money and turn your $500 premium into $800 of value to them so they can pay you $600. But now they're having to invest your money in other ways. And what's happening in this country fundamentally is that people have decided in the last 15 to 20 years that they should receive more benefit. And where this comes up is when people use the phrase out of pocket. People will say things like, well, if I go to the doctor and it costs me extra money than beyond what my insurance will pay them, I have to pay that out of pocket, as opposed to out of where. If you really walk into your doctor's office and you receive from them $90 bill, and you don't think that the insurance company and you have to chip in together to pay $90, where do you think that money's going to come from? So the fundamental problem we have with our healthcare system is people do not want to pay the amount of money that it costs for their health coverage. So we get into all these crazy little negotiated prices and cheaper cards that you can have for prescription drugs, and this deal that you have if you go to this doctor, and the whole thing is like this shell game where everyone wants more benefit than what they pay. In other words, if you pay $1,000 a year for your health insurance, or like we would have to do in our family, $8,000 a year, but I have to make a claim that's going to pay out $50,000, I have to have health insurance for our family for 6 years worth of premiums to pay that $50,000 cost. The only way it works is if people don't take out as much money as they put in. And this is where the problem lies. The only solution we're going to find to this healthcare crisis in this country is if we have a deep and significant conversation about how we should pay for our health coverage. We can dance all around that we want about more people being covered and less, but to ask more people to be in a system that's basically broken from the start, it's going to go absolutely nowhere. It's my view on it. Now we can talk about all the details in coming weeks, but this is Doug Pagitt Radio, religious radio that's not quite right, on AM 950, the progressive talk station, Minnesota.